Hello and welcome. I'm Dr. Ryan Kazemi, and I'm glad that you can join us today for our complex case discussion series. I'm delighted to have two of my dear colleagues as our panelists today. To my right, Dr. Brian Gray, general dentist in Washington, D.C., who I've known for a very long time. We have done much great work together, and thank you for being here. And to my left, Dr. Nagar Sagafi, an orthodontist, practicing in Bethesda as well as in Spring Valley. And thank you again for your time.
Thank you.
Today, for the case that we're going to discuss, all of us have interacted and worked on this patient. Now, this patient particularly is been in the treatment plan phase and had just recently started treatment. But we felt that it would be a great case as a discussion, and we'd like to share that with you. So let's go ahead and start. I want to give you some background. Again, the patient history is that a young female who had suffered a fall. She was seen in the emergency room for repair of some gingival lacerations. And tooth number 8 had a 3 out of 3 mobility, and tooth number 9 with 1 out of 3 mobility. And there was an incisal fracture on tooth number 7. She also had a through-and-through laceration of the lower lip, which was repaired at the same time. Now, the first imaging that was done was a cone beam CT scan, which is really kind of crucial to have in any type of traumatic episode, really to look at the roots, the foundation, the structure in the bone, to have obviously a more accurate diagnosis of the nature and the extent of the injuries. And she had a dentoalveolar fracture. Here we can see that there is a buccal plate that's been displaced. Again, this is tooth number 8 that had a 3 out of 3 mobility. And as part of the initial management, the tooth could not be salvaged, so it was extracted. The buccal plate was preserved. It was reduced in a closed fashion into position, and a site GBR was performed. The gingival lacerations were closed. The lower lip was also repaired. And following this, the patient was referred for endodontic evaluation of teeth numbers 7 and 9, since both of those teeth had suffered or were involved in the trauma. And she was advised to follow up in 2 or 3 weeks. And here's the closure of the laceration. She was seen about a month later for the treatment. Both teeth numbers 7 and 9 were treated, non-surgical root canal therapy by one of our great colleagues, Dr. Piruzia. And subsequently, patient returned. In about 4 months, we saw her to discuss the possible plans for replacement of her teeth, tooth number 8, as well as management and treatment of the other teeth. So this is how she presented at 4 months. This is a time that she actually had seen Brian prior to that for fabrication of a transitional prosthesis. She had been given an Essex appliance that she was using for some time, and this is when you saw her. So tell us a little bit about what your take was on that initial meeting.
Thanks again for having me here. It's a great chance to talk about a really fun case that we're actually going to be able to look at and kind of grow together. You know, we'll get back together and look at our progress down the road with it. But this was a traumatic event. Madeline had taken a bad fall, and she had fractured off that big chunk of bone that we saw there. That, as we mentioned, I think back, and I was looking at the images, and I was thinking back, 20 years ago, we would try and diagnose that with an X-ray, and just like how tragic, to do something like that and not know whether or not something would take or whatever. And we've got all this stuff at our disposal, and we were able to use a lot of it with her, which was great. Mm-hmm. So we went with an Essex because we like to stay off that soft tissue. It's kind of an easy sell these days over a flipper because everyone's familiar with Invisalign. We just say it's like Invisalign with some teeth in it.
Very much so.
You know, so they're comfortable. Does a good job holding. You know, it gives us a little bit of stability as far as the splint effect is concerned. And it gave us a chance to just kind of talk about what she would want to do. And she had a bunch of things going on, right? That aside from that, we'll look at these photos in particular. We noticed that her hygiene wasn't the best. You know, wasn't really adequate. And part of that was that she just was a little bit wary of wanting to even kind of touch up in that area. And you know, it was one of those chances where we were able to say, hey, actually, just the opposite. We need to have you really keep this clean. And we'll talk about it a little bit later, and Nagar will kind of refer why, actually, that's going to be really important. But at this point, we discussed different options with her. We said, okay, you know, now that things have healed and that lip lesion in particular, which just looked so well, you look at the picture on the left of your screen there, and you can see just how well that has, you know, healed up for her. I mean, the thing that sticks in all our minds is looking at a pair of suture scissors going all the way through the lip and coming out the other side. I mean, that's how traumatic it was. And so to be able to get this closed up and have it look the way it does, and this is old too, it looks great now. So we're able to talk about what we could do. And we really kind of discussed kind of 3 different options for her as far as being able to look at the restorative aspects of this.
Yeah, so this was obviously a very aesthetically challenging case for the following reasons. I think we both appreciated that there was loss of papilla, significant recession on the mesial of number 7. There was some vertical loss, of course, on number 8 area. And we can kind of appreciate the insufficiency of the soft tissue, as we see here. There was also a horizontal vector into the deficiency, and we can appreciate that from the buccal aspect. So when we looked at the cone beam CT scan at this point, what we noted, most important aspect of what we saw was the loss of bone, vertical bone loss on mesial aspect of number 7. So the interseptal bone had migrated more apically, and we can see the difference between the mesial aspect and the distal aspect of number 8. And this is obviously will change the game plan, both from bone, soft tissue, aesthetics, everything that we'll do will really be affected by that.